Hello and namaste, everyone. Welcome back to Everything and Everything. This is your host, Adi here. And today we have a very special guest, Miss Elise here.
Hello, guys.
And today we are here to talk about something that is very important, which is the healthcare system here in Germany. And as international students, we have to go through it a lot.
Yeah.
So to begin with, Elise,
Yeah.
someone who does not have a background here, someone who does not have anybody here, when they get sick as an international student, it can be very daunting.
Yeah.
So how should one deal with sickness here?
Yeah. So in my case, I have been somewhat fortunate because I have like family. My brother is here and his family. So I had like a backup support. But for the people who don't have anyone here who are new, I think they should focus on their health, their mental wellness. They should eat a lot. They should drink a lot. They should really take care of themselves because the routine and everything, it's really stressful here.
So you're a student, you work, and then you study, and sometimes you barely get time to eat.
Yeah, exactly. It gets really tough. It gets really hard, and the weather changes as well. It's cold, it's warm, so I think you should take care of that as well. So I think
what doctors say, drink a lot of tea.
Yeah, drink a lot of tea. I mean, I am like a tea person. I don't prefer coffee, so I'm good to go, I guess.
Yeah. But basically, you really have to make sure as a student that you first think prevention is better than cure.
Yeah, exactly.
So please eat.
Yeah,
it's very important.
Yeah, eat healthy, eat dry fruits, eat anything that is healthy, not the fast food, not the junk food, because the fast food and the junk food is convenient. But I would prefer you eat fruits, you take lots of fluids, juices, and avoid the cold drinks and all because it's really cold here.
Yeah, that's true.
Yeah.
So the first thing is that after you come here in Germany, you have to take care of certain things. Or even before you come.
Yeah.
So would you like to explain more about that?
Like the health insurance.
Yeah.
So the health insurance is very important. Yeah. Before coming to Germany, like when you get like your admission for the visa processing, the first thing you need is your health insurance. And I think it differs. If you're under 30, you can get like TK health insurance and it's really good. Above 30, I don't really know the private health insurances. So yeah, get your health insurance. It's very important.
What do you suggest to someone who is coming here?
Yeah.
So yes, they get the health insurance. I think it's compulsory for me and also for you to get our health insurance before we come here as well. It's a must for your visa. But after they come here, you have to go through all the documentation. And then what do you suggest?
Oh, get a house arts. Like it is the most important thing because you have like the big uni clinic here, the clinicum, the big hospital, but it is not really sufficient for you. Like, get in house arts. You can find like a house arts through your uni, or there are a lot of WhatsApp groups. You can ask, like there are very friendly people. Sometimes you can ask for help and try to get like a house arts who speaks English. If your Deutsch is not good, but if your Deutsch is good, it's fine. It's completely fine. Getting a house arts is very important because she will help you a lot through your journey of being sick. I hope you're not getting sick, but if you're getting sick, finding a house arts is very important.
And also like try to find a house arts who is not so jammed up.
Yeah, exactly. Who is not so busy. And it's really hard to actually look for these kind of house arts because people refer you to the famous ones, but they are actually really busy.
They give you a list in the uni when you ask, I want a house art. So they give you a list, but these house arts are normally very much jammed up by the students of the university. So I think for me, it has been very important that I find someone who is not super busy. And my friends have also been facing a lot of problems because they all are like, associated with the same house arts, and he's not able to give them time. So it's very important to not just find an house art, but also
who's not so busy.
Who's not so busy. That's the first initial step you do here. But then suppose now you get sick. Suppose you get sick and then you have to go to a doctor. It is a journey to get a doctor's appointment.
It's really
How
difficult.
has your experience been?
If I compare it with my country, it has been really difficult for me. It has been like a hell lot of complications that came in my way, because in my home country the hospital was a doorstep away. Yeah. And my health care is free, so I used to go back and forth to the hospital a lot because I have allergies and asthma, and I've been like a sick child ever since I was born. But here, when I was coming here, I was so concerned, and I was there was like a fear in me because I did not want to get sick. I want to be like an independent person now.
Yeah.
I have to take care of myself. So I had so many fears, and all my fears somehow came true because I got sick. One of the experiences was that I got hurt at work, and I went to the uni clinic, and I told, the problem was that I went after 2 days, because normally when you're hurt, you're like, okay, it's gonna get better, because you don't really think it's a big deal. But it was hurting a lot, so I went to the uni clinic. I said it's an emergency, but they were like, they neglected the whole thing, and they were like, how is this an emergency if you're coming after 2 days? I was like, it's hurting a lot now. I thought it will go away. And they go into detail about how it happened, why it happened. It's not important, it's irrelevant, it doesn't seem like a big deal, you're just making things up. And then I had to go home because they just rejected my pain, or that I'm hurt.
The whole thing.
Yeah, completely. So this was one experience. And then just because of my hormonal issues, I went to the gynecologist, and I was like, it's an emergency. But the gynecologist was like, okay, we'll
what
give
kind
you
of
like,
hormonal issue did you have? Were you like...
my periods were coming, I think, in 2 times in 1 month.
Oh wow, okay.
Yeah, so it was like the first time it was ever happening to me, because my cycle has been really good. Yeah. So I went to the gynecologist. I asked for an appointment. They gave me an appointment for after 6 months, and they called it like an emergency appointment. So, for example, I went in 2023 and I got an appointment in 2024. So it doesn't make any sense. It's an emergency, and they were like, no, this is like an emergency appointment. So okay, I was like, okay, just give the appointment. I took the appointment, and I ignored the whole thing. But I think it was getting a bit more complicated, like my hormonal issues, that I started feeling like a lump on my left side.
Okay.
Yeah. And I was concerned, and it was hurting a lot. It has never hurt, like my chest don't really hurt. Yeah. So it hurt a lot, and I talked to my family, and my family suggested that, like, go to the doctor. And I was so concerned because, like, they already gave me an appointment so late. So I was like, okay, now what should I do? So I decided to go to the general practitioner, the GP first. And fortunate enough, the GP was good. Yeah, she was concerned. She looked at me. She first gave me like an antibiotic for 1 week, because she thought that initially it's like an infection, although I knew it's not an infection because I know what an infection looks like. But then I was like, okay, maybe she's right because she's the doctor, I'm not the doctor. Yeah. But after 1 week, it didn't go away, and the pain was still there. So I went back, and then she got concerned. She asked me about my family health background. If I have cancer in my family and stuff like that. So I got a bit scared. Yeah, obviously you have different kind of fears, and your brain works in a certain way. So I was really concerned, and she was concerned, and she made me more concerned. She gave me like an early appointment with the gynecologist. It was after 2 weeks, I think.
Okay.
Yeah. So I went to the gynecologist. Oh, that was there was like a very a weird scene that happened. I forgot, like, they give you like a slip.
Yeah.
I forgot the slip at home. Yeah, and they were like, we're not gonna check you without that slip. So I had to come back home. To get the slip and then go again. Imagine, like, I'm already in a lot of stress, and they want me, and I don't have a car here. I have to travel through bus or cycle. So okay, fine, everything done. I went there, she checked me, she said it doesn't like seem a big problem, but we would still want you to do like a biopsy to be sure that it's not cancer. So my first instinct was like, you should know if it's cancer or not. You're the gynecologist. I mean, if you're saying it's not a big deal, why should I go through like a small surgery or something like that? Because it's still a surgery. Yeah. But then she was like, no, you have to. I was like, okay, fine. I'll do that. So initially I didn't know what a biopsy was.
Yeah.
And I didn't really look into it because I did not really want to think about it, because a lot is going on. We're working, we're studying, we're doing our groceries ourselves, we're cleaning, and a lot of things. We're making time for a lot of things. So I tried not to think about it. I think my appointment was 1 month afterwards, and then I was going to back home. Yeah.
Okay.
So I went to that after 1 month. I was still in a lot of pain. They didn't give me any medication for the pain. They didn't do anything about the pain. They just wanted to do the biopsy. So the doctor was really nice. She asked me about everything. She did tell me that, we're going to do like a biopsy. Did you do breakfast? Did you eat? Did you drink? And it's like a procedure, so it will hurt. And she knew English, which is good. She knew English, so the conversation was good, and I could understand what she was saying. The gynecologist I went to before didn't know English, so I couldn't understand anything she was saying to me. So this gynecologist was good. She did my biopsy. It was painful, but she did guide me through. She did tell me that you have to take like ibuprofen, for the pain. Like, she did give me medicine for everything. So yeah, this happened, and she said that we're gonna call you after 1 week to tell you the results, because they don't really give you the results for some privacy reasons. I don't know what those reasons are. So anyway, I went back to Pakistan. She did call me. She said, it's not cancer. Everything is okay. But I was curious. I wanted to know what it was. Yeah. Nobody was telling me what it was. So I went to Pakistan. I went to the gynecologist, and I did everything again. It was quick. It was very quick in Pakistan. One day I went and I got everything done, and they told me that the biopsy and everything was irrelevant. It was only because of my hormonal issues. And they gave me a solution that I have to do this to prevent the whole thing.
Yeah.
Yeah, so it was very quick. Where in Germany, it took like 3 to 4 months to figure out what was going on with me. They didn't give me the medication. But in Pakistan, everything happened in 1-2 days. That's it. Without an appointment, without booking an appointment. I just went to the hospital. I told them my problem. They checked me, and everything was done.
Yeah, so I think the issue here is that, yes, it is important that you have in healthcare, that you have an insurance.
Yeah.
It is important when you come here to have an insurance, but at the same time, we have to acknowledge that German healthcare system is not as fast.
It
is
not fast.
The service is not fast.
Yeah.
Services, I would say, is poor.
Yeah, true.
It is poor. Like, for my experience as well, when I first arrived here after 5-6 months,
Yeah.
or even 7 months, I started getting on my periods.
Oh no, yeah.
And it continued till the whole 6 month.
Oh.
So I was basically bleeding for a whole 6 months, and it was so hard for me to find a gynecologist.
Yeah.
My Hausarzt was not. I made the mistake of going to a Hausarzt who was very jammed up with a lot of people.
Yeah.
So then what happened was, I could not find any gynac. I called literally everyone here in Göttingen. One gynac was giving me an appointment a year after. Okay.
No, yeah.
And the minimum I had to wait was 6 months, like you said, 6 months.
Yeah, that's like the emergency appointment.
And I was crying. I was in so much pain. I was basically, my normal periods are also very horrible.
Oh.
I am in a lot of pain.
Yeah.
And now what is happening is, I'm getting those kind of pains every day.
Oh no, yeah.
And I have to work, really, I have to study.
Yeah, exactly, yeah.
And then this on top of that.
Yeah, it's quite stressful.
It is very stressful.
Yeah.
And I had nowhere to go. I did not know what to do.
Yeah.
I tried my best to call Tike. They could not. The thing is, Tike is a good service because they speak English, first of all.
Yeah.
It's very important, and they have, I think, 24 hours call service, customer care service, which is also very good. I'm not sure about the hours, but I think they have good. And the other thing is that if it's if it's hard for you to find a house doctor, or like any doctor, a gynac or a oncologist, then they actually provide you with that.
Yeah.
They help you with that as well. So it is a good health insurance.
Yeah, it is actually.
Yeah, it is. But the thing is, it does not cover everything. Yeah, having said that, it does not cover everything, and I think German health insurance and healthcare system overall is quite expensive. So also that's why they cannot cover everything.
Yeah.
But then it was so hard for me to find a gynec because even TK could not help me. Even they could not find a gynecologist who was able to give me an earlier appointment.
Yeah.
And I was really, my mental health was also very much affected by this.
Yeah, definitely. Yeah,
very much affected.
Definitely.
And now I was at a very low point. Basically, I was very at the lowest,
Oh.
And then I cried, and then I went to one of my neighbors, and there were a lot of girls there, and then they helped me out. So there's a rule here: if you go to any praxis, they cannot deny you with an appointment.
Yeah.
They cannot deny you with a treatment. Then finally, after she said that, which I had no idea of.
Yeah, because we don't really know.
We don't know.
Yeah.
I went to the gynec. Okay. But before that, when I called a lot of gynecs, I found one gynec who was able to give me an appointment in, I think, 1.5 months.
Yeah.
So I had already taken that appointment. And I was like, okay, fine. I now have an appointment. Yeah. I went there, and this gynec was so horrible. I'll tell you why. First of all, I went there. In my head, back home, what happens is that when you have anything related to gynecology, you always get an ultrasound, especially something like this. Yeah,
that's the first thing. Yeah,
that's the first thing that they do.
Yeah.
And in my mentality, I thought, okay, I have to do an ultrasound. He will do an ultrasound today, so I have to stay hungry because that's what normally happens back home.
Yeah.
But for an ultrasound here, you don't have to stay hungry because they have another instruments, and you don't have to. You can eat your food. But I did not know that back then, and I was hungry. I went there. I had to wait for 2 hours or 3 hours to go inside the doctor after my appointment.
Yeah, it takes a lot of time.
It takes a lot of time. Yeah. And then when I went inside, he checked everything, and he's like, everything is okay, everything is normal. You don't have to worry about that.
Without an ultrasound, yeah?
Without an ultrasound. And I was so confused when I came back. If nothing is wrong,
how does he know? How did he know without?
I know. So if nothing is wrong, then why am I bleeding?
Yeah.
And during that time, I was not super stressed.
Yeah.
I just came here, yes, adjusting to a new climate, yes, but I was okay.
Yeah.
I was doing pretty good. I was handling things well, but my inner body was not handling things well.
Yeah, exactly. Yeah.
And after the period didn't stop, then only then I was tense, and only then I was suffering. Okay, only then, like, all the problems that I was, mental health issues started. But again, I got an appointment from him the next time. I went there, but I was 20 minutes late.
Yeah,
I had a professor who was holding us down, and I could have gotten out, but I was so new. I did not know much,
Yeah.
So I thought like it would be disrespectful to just get out of the class.
Yeah, it makes sense. Yeah,
that's what happens back home. So I did not know, but here you can get out the class
anytime you want. Yeah, without even telling them.
Without even telling them. So I did not know this, and I was waiting for him to stop the class, and I had already missed my appointment. It was 20 minutes late, but I just ran and I went to this gynec. They canceled my appointment here now.
Yeah, just because you were late. Yeah,
just because I was late. The problem here is, first, it is super hard to get an appointment.
Yeah.
Second, you have to separate a whole day if you have a doctor's appointment.
Yeah.
Third, if you go even 10 minutes late, they will cancel your appointment. But they will make you wait for minimum an hour. Yesterday also I had a doctor's appointment. I waited for an hour and a half. Only then she came and checked me. This is not fair.
Yeah, it's not fair.
If you have given us a time slot, either check within that time slot.
Yeah.
Or if we come 20 minutes late,
that should be okay. That should be
okay for you.
Because we have an appointment, we deserve to be checked at that day. If you can ask us to wait for like 3 hours maximum and minimum 1 hour, then you can wait for like 20 minutes.
It's because either way, if I was even during that time, if I was there as well, they would have still made me wait.
Yeah, there can be any emergency. What if you have been into an accident or something has happened, or your friend has been in an accident, or you're helping something? Yeah, anything can happen.
Anything can happen.
I think here people are a bit like, I won't say straightforward. They're just not very sensitive towards.
Yeah, I understand.
When you expect doctors to be sensitive towards you, because they should understand what we're going through.
Yes.
We're sick. So it affects us mentally as well.
Yes.
But here, the people are very numb to everything, I think. And especially the doctors, they don't care.
And to be honest with you, in this clinic was very much racist as well. Even when I was studying in India, I have faced racism there as well. But I did not expect something from a clinic, basically.
Yeah, exactly. Yeah.
I did not expect that at all, and it was never even in my mind.
Yeah.
And after I had to fight basically that day, because I literally cried there. First of all, you don't get an appointment here. Even after you make us wait for so long.
Yeah.
And if we are a little bit late, you cancel our appointment.
Yeah. And you're very rude to us if we don't know the Deutsch, like the language.
Yes, and this girl the receptionist was speaking to me in German, and I was trying to tell her, okay, fine, I'm late.
Yeah.
The doctor does not need to check me.
Yeah.
Can I just talk with that doctor? That's what I was repeatedly telling her. And she was like, 9, 9, 9. And she was like, and I was like, fine, you're not going to listen. I'm directly going to the doctor. And I just went to the doctor, and she came shouting. It was a whole big deal.
Yeah.
I went back home. I talked to all of my German friends. This thing happened. And they were the ones who told me that she was being racist.
Yeah, definitely.
Because I didn't realize it back then. I was so caught up into my health.
Yeah.
And they made me realize, no, she was very much racist towards you. Because if it was another German person, that would not have happened.
Yeah, that would have never. Yeah.
So that was my experience with this doctor. And afterwards, I found out through a lot of German people I know. Yeah. This doctor is not a good doctor. He is not a good gynec. And I had to go to our who's in charge of our courses, and I had to tell her a lot of things and stuff, and she was like, please complain against this doctor. Yeah. And during that time, I was so much caught up in my health and everything. I just did not want to go through with
anything it's already too stressful, and we expect things to be less stressful, but
it's too much.
The healthcare system is not.
It's really horrible. Yeah. And finally, because the friend suggested that there is a loophole here where you go to a gynec and you get an appointment because they cannot deny you treatment. Finally, this gynec was so nice. I told her my problems and she gave me an appointment because it is a concerning issue for someone who's bleeding for 6 months. By then,
yeah, definitely.
It is a concerning issue,
Yeah.
And it was not stopping.
And it's stressful for the body itself.
Yeah.
The experience of bleeding is not really nice.
It's not. Yeah. It's not. And then she gave me an appointment, and the first thing that gynec did in her appointment was an ultrasound.
Yeah.
Because that's the basic thing that you do when someone tells you that you've been bleeding for a quite long time. And then she checked everything out, and she said, you have been stressing a lot. There is an issue that I think everything looks okay when you look at the gynec, but yes, your periods are not normal and you have been stressing a lot. And then I told her, yes, because it's so hard to find a doctor here.
Yeah, it's mostly because of you guys.
It's mostly that's what's stressing me more. Yeah. Also, I had some other issues that I was working back then, so I think that was also something that was very much stressful.
Yeah, even when I think we don't really realize that we're in stress.
Yes.
But our unconscious state or subconscious state is in stress, and because of that, our body gets into stress.
Yeah.
Yeah, definitely.
So basically, I bled for a whole 6 months because of stress. During that time, I was in a stressful living situation, a stressful, not just living situation, even at work. So basically, wherever I go, and university itself is quite stressful, to study and all is quite stressful. Yeah. So wherever I go, it was all stress. And even though I tried to relax and do a lot of things, it did not work out.
I think it takes about 1 year to actually settle into the Deutschland.
Yes.
You start to understand the ways, and even not just the ways, how things work, like how we need to process the work, the studies, the everything, the managing everything.
Yes.
So
I think time management. Time management is a skill that you really quickly need to learn after you get to Germany.
Yeah, and the rules here.
Yeah.
You really need to know the rules or get to be friends, make German friends, because they might help you. Yeah. Because as international students, we don't really know what's going on.
Yeah, but also it's very hard to make German friends.
Yeah, because like, of course, if you're not speaking Deutsch, nobody really wants to talk to you like that.
It's very hard. So either way, it's a new country. It's challenging everywhere in the world, but because of language, also it is quite challenging here in Germany.
Yeah.
And the doctors here,
honestly, I would just say it's terrible. I mean, I would expect a third world country to have like a terrible healthcare system where I come from, but if I compare it with Germany, I
think it's better.
I would say it is so better.
And not just that. So for the past month in August, I was having I was puking everything I ate. Oh, damn. I don't know what is wrong. I still do not know what is wrong. I was puking everything I ate. I was having so much pain in my stomach above and also
maybe
in the
it would be like
region.
gastro something.
Yeah, and it was horrible.
Yeah.
I went to emergency 3 times. I had to, because I was about on the verge of fainting, so I had to go on emergency. I was not able to eat anything. I was just surviving on bananas, milk, and rice and yogurt. So these 3 things apparently helped. 4 things apparently helped me. But I could not eat any salt. Nothing was happening. I tried a lot of things to eat and nothing was working. The pain was so bad that blood was coming out. Oh, fuck. Okay. No. And I was very concerned now. What is going on? I have no idea. Yeah. So I went to the emergency healthcare system. One thing you have to know is that because I have an experience of emergency healthcare system in Germany before, I try as much as possible to avoid going there. Yeah, exactly. Me too. My experience has been really bad as well. Yeah, so we can share your experience. Yeah, whenever I went to the uni clinic, I think I went to uni clinic for to get like a leave, like Krankengeld or Kranken something. I'm not sure what it's called, from my work, because I was sick. So apparently I didn't know that uni clinic doesn't really give you that. Yeah, because no one was there to tell me and I didn't know. So I went to the uni clinic. I told them that I'm sick and, I need like a few days off of work because I can't work. And they were like, go to your house arts, go to your house arts. I was like, my house arts is not available today. And it's an emergency and I can't work tomorrow. I need like a off day from work. And they were like, no, we cannot do anything about it. You have to go to your arts. Okay, go. If it's not available tomorrow, today, go tomorrow. Yeah. Like they were like, just get out of here. We don't want to talk to you. And they were speaking in Deutsch. They did not want to come make conversation with me in English. They did not care I was sick. They did not care. When you go to an emergency, when there is like an emergency. Yeah. When you're all drained, you're sick, they make you wait for 3-4 hours. You're sick and you're waiting for 3-4 hours. And then they say, we can't help you, go home. Yeah. What's the point of the emergency then? So if your house arts is gone, normally what happens is that the house arts suggests another house arts should take over the patients for the time being he's gone. Yeah. So I think you did not know this as well. Yeah, because even I didn't know it. Like I said, we are new, and maybe the emergency place was supposed to tell me one house art. They could have provided me with some other house arts. Yeah. I could have gone to that place. Yeah. But no, they were like, no, go. Just go home. Yeah, I got it. Yeah. They should have provided you with the answer that when a house arts is not available, then they give somebody else in charge during that time. If they had done that, you would have just found it, to be honest. Yeah, but that's the issue here, And there's a subtle... I think they have also a thing in their brain that people from, other countries, they get so much sick often. And maybe some of us has also like just fake things. Maybe like that's why they treat us like that. But they shouldn't judge us on that basis. Yeah, I mean, look at us, our faces. You can see it. That we're like, Yeah, exactly. You can see it. But for me, I had an incident at work, and then I went to emergency because both my ligament from both hands and my legs are torn. Okay. Oh damn. And the doctor back home, they told me way before, when one of my ligament was torn, that it's better to have a broken hand than a ligament torn, because it's... Yeah, I know. Because when I got hurt here, I thought maybe there's some kind of problem with my ligaments. And I did tell them, and they were like, we don't care. They were literally like, we don't care. Yeah, so does not ever recover. To be honest, it's been so many years. Like the one that I had back home, it's been so many years, it does not recover.
Yeah.
And I don't know what was going on, but I was having a lot of pain in my hands, both hands, because of an incident at work. And then I went to emergency. I had to wait for 7 hours that day, 7 to 8 hours that day, just to get me checked up. And the problem here is, oh my God, it's an emergency.
Yeah.
I understand also that they are taking those emergency cases that
are very serious.
that are very serious.
Yeah.
Understood.
Yeah.
But how is it possible in a country like Germany, which is a first world country,
exactly,
that you do not have quick healthcare system?
Yeah.
I mean, you have that in Nepal, which does not really
exactly
have a good healthcare
exactly
system,
what
but
like
they still check you.
Yeah.
And the problem here is that yes, we have a government hospital where people who cannot afford a high quality treatment, they go. Even I go in the government hospital, they're very good, but they check you. You have to wait there also. Does not mean you have to not wait, but they check you, and basically you don't have to wait for 7 hours.
Yeah. I think maximum I have to wait is for 30 minutes.
Yeah, for me it has been when I go alone, something like that in a healthcare system, I have to wait sometimes for 2-3 hours.
Yeah.
It depends on how much crowded it is.
Yeah.
But they make sure that everyone is checked according to the time they've been there. Which is fair.
Yeah.
Which is fair. And if it's really emergency, then they provide emergency services as well.
Yeah.
Here, it's a completely different situation.
Even if I go to Pakistan, if I told them that I have a problem here or something, they will run like an X-ray.
Yes.
They will definitely run an X-ray.
Yes, very true.
Yeah.
Even when I had my problem with my legs, and I went to the doctor, and then they checked everything out, and then they did, they suggested me physiotherapy. And that day itself, they they put me to a physiotherapist. They made the physiotherapist look at me, and then he suggested me some exercises that I could do to make it better.
Yeah.
But thing is, the service is good. That's the problem here.
Yeah,
in
the service is fast,
good here,
and it's good, and they satisfy you.
Yeah.
Here, I don't know.
It's very annoying from the start.
Yeah.
First to get an appointment, then to go and wait for the doctor, then to go again and wait for the results that does not come back.
Exactly. Now I have like a problem with my shoulder, but I'm avoiding going to the doctor just because of the fear of unknown. Although I already know what's gonna happen, they're gonna make me wait, or they're just gonna say, it's nothing. So I should rather just be at home in my bed resting.
Yeah.
So right now for me, avoidance. Like I don't want to go to the arts because it's like a hassle.
Yeah, I completely agree with you. Even I try as much as possible to stay healthy and not go to a doctor, because that's another stress that comes in your life. And go there, your whole day is wasted. You have to take work off your day. You have to stop everything else you're doing, and it's a hassle here. So even when you compare it back home, you have different levels of healthcare system. And it is good. I have to say that, not just because I was born there and stuff like that, it is good.
Yeah, here, and the doctors are good. They care for you.
They are good, And here also, I do say that TK services are good.
Yeah.
That I can say, TK services, the health insurance services are good. But when you go to a doctor, then again, it's
hard.
It's really hard. You have to wait a lot. You really have to just wait.
Yeah.
Be patient.
Be patient. If you have a lot of patience in you, and if you have a lot of time in your day, then you can definitely go to the doctor.
Wait. Yeah. And also, like when I got hurt in my hand because of the work, you have to go to an emergency apparently because it's a work accident.
Yeah.
And so I did not want to go. Yeah. I really wanted to avoid, but they made me wait for 7 hours. And I was just thinking the whole 7 hours, why did I come here,
Yeah.
It's just, I don't know what it is, to be honest. And you have to pack. Please take a lot of food with you when you go.
Yeah, take water, take food, because you have to wait a lot.
You have to wait a lot, so take everything with you when you go.
Yeah.
And for someone who is here, who's getting sick and who does not have somebody, please stay strong.
Stay strong. Try to be mentally strong to cope up with the things that you would have to go through in Germany. And I hope that you don't go through the things we have been through, and your
Yes.
experience should or have your experience should be better.
Yeah. But also, if you see this video, I think we have given you some tips regarding, how
and maybe they can help you.
Yeah, maybe they can help you, and also mentally prepared that these things we have faced.
Yeah.
And also, a lot of international students who have faced similar things as we have. So please do not take these things lightly. Does not mean like we're saying German healthcare system is horrible.
Yeah.
No. The doctors, they do check you up.
Yeah.
It's also good that they did your biopsies. They, at
Yeah.
least cancel the cancer
Yeah.
thing out.
Yeah.
So it is good. But the services is the problem that I'm
Yeah.
questioning on, and which is bad. And I think being Germany, we all should work towards having a good service for people as well.
I think when we come to Germany, we expect it to be better than
Yes.
where we come from, but
Yes.
the disappointment comes when we get to know the whole thing, that it's not really good, and then we have it's like a surprise to us. And so I think just come prepared that
Yes.
you will have challenges, and you will face, I hope you don't face, but you might face difficulties when it comes to the healthcare system, at least. Yeah,
it's very true. And we also, as Nepalese, I think we had one of our friends who passed away because of a lot of things he did not know. So it's
in Germany.
In Germany, yeah.
Oh, damn.
So it's always better to know what you are coming towards. It's better to always please find a house doctor, and not just house doctor, to all females.
Yeah.
Even if you do not have anything currently going on right now with your gynac,
just try to get a gynae for you.
Even if it's 6 months, get the appointment, take the appointment, and wait. But please show up to the appointment and have a gynac by your side. It's very important. Crucial. Yeah, it's very crucial.
And a house arts.
Yeah, house arts and gynac. Because the gynac is the one that is it's very hard to get an appointment for. Yeah. And because I think there's a very less amount of gynac here.
Yeah, it's a small town. It's a small town.
It's also because of that. We live in a small town. Yeah. And we have a lot of students here and less amount of doctors. So that is also one of the things
maybe
that
it's just
keep in mind.
Our city, but I wouldn't say I've heard experiences about other cities too. So it's overall Germany.
Yeah. But also, if nothing works, and if your city it's really jammed up with doctors and you cannot find, and you need an emergency care, try calling other cities as well. Try to find appointments in other cities as well.
Yes, because my friend, one of my very good friends, she called, she wanted to get a gynae appointment. She didn't get any in Göttingen, of course. So, but she called in Hanover and then Hamburg, and she got a very early appointment in Hamburg, and everything was very quick.
Yeah.
So you can try the other cities as well.
Yeah. If I knew that before, I would have done the same thing.
Yeah, exactly.
But this is things. These things we do not know. So please learn about these. I hope you learned something from this video, and you do better when you come here.
Yeah.
Thank you so much, Alize. Thank you so much for coming.
It was really nice having a conversation about healthcare system. Yeah, it was really nice.
Yeah, because I think everybody is frustrated regarding this.
I wanted to get it out. Yeah. And now it's out.
So guys, tune in for our next episode. Ciao.
Ciao. Bye.